Happy Wednesday.
It is Wednesday.
Yeah. Thank goodness, right?
Thank goodness. Yeah, I did not want to get out of bed this morning. Why is that the hardest part of my day?
It really
Just
is.
Convincing myself to get out of bed.
I know, and I was so cozy this morning, and Henry snuggled up on me. He's so funny. Last night he got all up underneath the cover.
Do you have to hold it up for him?
So he's getting antsy about it now because he'll get in bed and he's like, it's time to get under the covers, Mom. And he's like pawing at stuff. So sometimes I have like bruises.
Yeah, show him this bruise over here. I'm not quite
yeah,
sure
it's
what
probably
that's
from him. I don't know. But he's like digging to try to get under the covers, but he doesn't actually know how to get under the covers. I have to hold them up for him because that's the kind of dog mom I am. I hold up the covers. Come on, Henry. And then he gets underneath there, and then he'll lay down for a little bit, and then he'll kind of turn around and like look at me, and then give me some kisses, and then he goes back under.
Oh. That does sound pretty cute.
He's pretty funny. He's kind of the funniest doggo. Yeah. So today we're going to talk about anxiety. You want to hear my song?
Oh, I forgot. Yeah, let's do it.
Nobody else is going to know this song. You know this song.
Do I?
Yeah. Oh, no, I hope I didn't
You're
lose.
sure that I know?
You heard the song.
Your words were gentle, reflected in my window. I knew you would be the kind of girl that I could talk to.
Because you
And you seem like it kind of strange. Why can't you be a little less insane? I may be crazy, at least I'm medicated.
It's true. I do like that song.
Loudon Swain.
Shout out.
Shout out to Loudon Swain. We heart them. I don't know. How many times have I seen them in concert now? Because I think I've seen them in concert twice in Austin. And Jenny and I went to Chicago, and we went to... Did we go to another one?
You're not counting the convention?
I'm not counting the conventions.
Oh, okay. Okay.
They also play at the Supernatural conventions. That's
They
how
do.
we've heard of them. That's who we know. That's how we know who they are.
Yeah.
Yeah. It's God. It's Chuck.
It is Chuck.
So today we're talking about anxiety and maybe some medications for anxiety.
Yeah.
So there's a lot of different reasons that pets can have anxiety, and it can be cats and it can be dogs. So when a cat has anxiety, what symptoms do we typically see?
Usually they're having urinary problems, whether it's going outside of the box. So when cats get anxiety and it's urinary related, it can seem just like a UTI.
Yes.
So blood in the urine, they can be trying to go and nothing's really coming out. They can have, sometimes they're crying when they're using the box.
True.
Urinating outside of the box. They can also defecate outside of the box as well with anxiety. Yeah, that's typical for cats.
And sometimes they'll go in
Panting.
one. Yeah. Sometimes they'll go in one area, and then other times they'll just go randomly throughout the house. So that doesn't really tell us one way or another whether it's a UTI or if it's stress or anxiety. What I will say is typically in cats that have inappropriate elimination, is what we call that. If they are middle-aged, like adult middle-aged cats, so kind of like the 1 to 8 range in age, it's usually stress and anxiety. UTIs are more kind of like the really young, that their immune system's not fully formed yet, or the very old, that their immune system's just kind of not working like it used to. Yeah. So, when we see a middle-aged cat coming in on the schedule and it's like, possible UTI, I'm like, bet it's not.
Yeah.
Bet it's not. I mean, we'll culture them and we'll see, but it's probably not. And so then the question is, do we, are there medications that we're going to put them on long-term, short-term? Are there changes that we can make to try to reduce their anxiety? Or is it something that, it's not going to change? Maybe there's a stray cat outside. There's nothing that anybody can do to prevent that. And so then we talk about things like meds.
Yeah.
So,
Or you've moved and, it's not possible for you to move back.
right.
That could be an issue. A
Yeah.
lot of times people are just like, well, can't we just give them an antibiotic shot? Or can't we just give them a shot for whatever? And unfortunately, if there's no infection, antibiotics aren't going to work.
No.
Or, it may help temporarily, but probably not.
Yeah. And when we see these that come in with a history of chronic UTIs where they've been treated with multiple kinds of antibiotics, but it either doesn't get better or it always comes back, that's probably what is. It's probably not actually a UTI.
Yeah. And we're not doing them any favors by just sticking them on an antibiotic and
Right.
seeing if it helps. So,
Yeah. So I know that's frustrating for some people because they want that quick fix, and it's not. So with anything with anxiety or any kind of behavioral issue, unfortunately, there's not a quick fix, and it can be very, very frustrating. And
it's a lot of trial and error.
Yeah, and I think it's something to think about. As we start treating them, that it's gonna take some work to figure out. Yes, we start with what works for most patients, but that doesn't mean that that's what's gonna work for your pet. So.
Right.
Yeah, it's frustrating for all involved, for sure. And
And
I was
cats-
sorry, go ahead.
No, I was just going to say, cats get anxious about some of the weirdest things. So I feel like a lot of times, I think we talked about this before, but a lot of times people get cats thinking that they're very low maintenance and they don't need a whole lot of either attention or care or, you can get an automatic feeder, which is what I have for my cat. But
We were crooked.
and then you can just, set up the feeder and it feeds them. And it's great. I love my automatic feeder. But my point is a lot of people get cats thinking that there's not a lot that goes into having one. But I feel like a lot of times when we see anxiety, there's a lot of cats that get anxious or, irritated, upset about things.
I think because we try to conform them to our lifestyle, and it really needs to be the other way around. Dogs are more amenable to that, and cats not so much.
Exactly. So I feel like, cats just get really upset about the
Mm-hmm.
weirdest things.
Yes, they do.
Moving their litter box can be a big stressor for cats. Maybe you added on a room to your house or you had a baby or whatever, and that was where the litter box was before, and now you moved it somewhere else because now you need that room. That can really set them off too.
Yeah.
So
Yeah, any little change can certainly trigger a cat's anxiety, for sure. They're sensitive little creatures.
they are
Delicate
flowers.
They are delicate
Like
flowers.
me.
Like Crystal. Crystal's like a cat.
No, Amy's like a cat.
Amy's like a cat. So dogs, we see obviously anxiety as well. They tend to have a couple different kinds. Theirs tends to be, I would say in general, a little bit more situational. So where it's like, it's around new people, or it's when they leave the house, or
Fireworks.
Fireworks. Like I feel like for a lot of dogs, they certainly see the ones that it's like they're just anxious all the time. But I feel like that's less common. I feel like I see more of like, it's separation anxiety or something along those lines. And so with that, fireworks, there's not a lot we can do about that other than drugs. Same thing with storms. It's just going to be drugs, really. But for other types of anxiety, we are probably going to talk to you about doing a multimodal approach. So, meaning that, unfortunately, just sticking them on a medication is probably not going to fix it. They probably also need to be working with a trainer. And what trainer you choose has to do with what the issue is. There's certain training methods that can certainly make anxiety worse. I don't typically recommend doing things like shock collars in an anxious pet. That's going to make them worse. That's no bueno. because it's just something else for them to focus on and be anxious about. So now you've just made things worse. So
Or they're not paying
fantastic.
attention to what you were asking them to do the first time
Right.
because they were so anxious, and now they're getting zapped for something that they don't understand what they were even supposed to be doing.
Yeah,
So.
like
Yeah.
it's just not a good thing to do. So we typically recommend working with trainers that use positive sort of like reinforcement and things like that. And not that there can't be consequences to actions. That's not what that means at all. But they're using more kind of positive training methods, so encouraging the behavior we want to see more so than focusing on just eliminating the problem behavior. So, and sometimes too, with getting them some confidence in some other areas, that can certainly help reduce their anxiety overall. Some dogs, it's like a breed thing. I do feel like there are certain breeds that we see are more anxious than others. A lot of the herding breeds and the high energy breeds are going to be far more likely to be anxious.
I feel like, and look, let's see what your take is on it, but I feel like with the herding breeds, they want a job.
Yes.
They want to be doing something.
That's exactly
and they,
right.
Yeah. You know, you can't get, I knew someone who had a husky in an apartment. They're not going to be happy
It's not ideal.
with that. I mean, most huskies are not going to be happy
general
with
rule
that.
of thumb, yeah.
You know, they're not couch potatoes. They don't want to just lay on the floor and, you know, they want to be out running and doing things and chasing a ball or herding cattle or, you know, whatever it is.
Yeah.
And we've taken that away from them.
And then where does all that energy go? It starts to go, you know, they don't have an outlet for it, so then it just goes to things that they should not be doing, like destroying your house.
Yeah, I mean, it's just like a kid. You can't put a child in a room with nothing and expect that they're going to be happy.
Yeah.
Kids are meant to play and run around and be crazy. So it's the same sort of thing.
Yeah, for sure. And that's why I think that we see more anxiety of certain breeds than we do with others. But yeah, separation anxiety can happen. And I think that that's something, unfortunately, that we're going to see more of. Because we've seen a lot of people get new pets during COVID and during, you know, quarantine and things like that. Like, oh, great, we're going to be home all the time. This is the perfect time to get a new puppy and house train it, which is great from that standpoint. The problem is, if you have not gotten them used to you not being there, when you are suddenly not there anymore, what do you think their reaction is going to be? That's going to be an issue. And so we've been talking to people about when they get new puppies, like, give them some time every day that you are not there. Even if it's like 5-10 minutes, like go drive somewhere and go get some ice cream without them, or, you know, go take a walk around the block without them. Leave them for some period of time so they can learn those skills.
Yeah.
And how to soothe themselves and how to be on their own. Because otherwise, yeah, they're just going to be anxious balls of energy and destruction.
Yeah, they're going to become super codependent on you because you're always there. I know some people are saying that they're just now getting back to work or like within a couple weeks.
Yeah.
Which is crazy to me. But yeah, I mean, if you got a puppy 2 months into COVID, you've been home with them for over a year.
Yeah.
Like their entire life, basically, you've been home, not going to work for 8 hours a day. That'd be stressful for anyone.
Yeah.
To just be like, oh, okay, well now I'm going to work, so have fun in your kennel. I can't imagine leaving a 1-year-old dog out of a kennel, but that's just me. So putting them in a kennel for 8 hours when they are maybe in a kennel 8 hours a week, like that would be stressful.
That would be very stressful. So yeah, what do you expect is going to happen? And again, medication is not going to, like, we're not just going to put them on pills and say, there you go, you're fixed. Because it's, number one, medication alone is not going to fix the problem. Number two, it doesn't help anybody to just shrug them up all the time.
Yeah, we're just going to sedate them for the rest of their life.
Medication has a place. It absolutely does. But it is not the be-all, end-all. Especially if you have a pet that is very young. I am typically very hesitant to start them on meds because I think that they need to be working with a trainer first. If you're truly having those sorts of behavioral issues, seek help Seek help
Seek
with it.
life
I knew you were going to say
elsewhere.
that. I knew she was going to say that. But seek the help of a trainer that can help them cope and teach them some strategies and build that confidence and that.
Right.
I
mean, and training for a new puppy or any dog really is never a bad idea.
Right.
Yeah. So.
A necessity.
Mm-hmm. So I think that that's a great option. I mean, and medications, they come with risks, regardless of the medication. So any dog can have any reaction to any medication. That's what I was taught, and I mean it's true. Certain people are like, oh no, I swear that this happened with that medication. Well, I've never seen that before, but who's to say that it didn't happen? Yeah. So we hate to put them on something, especially so young. We had someone come in with a really rambunctious puppy that's like, she's crazy all the time. We need something to calm her down. Take her to the dog park. Get some of that energy out. And for some dogs, that's still not enough. Yeah. I mean, they're still going to be crazy.
But that is definitely step one. Make sure they're getting good exercise on a regular basis, for sure. Because if they're, again, like the herding breeds and things like that, that it's like they're just a little ball of energy. If you burn some of that energy, now we have less to focus on bad, anxious behaviors.
Right.
So medications that we might put them on, like I said, in a lot of dogs it seems like it's more kind of situational, and so in those cases we may do something like some Xanax or some
Let's
trazodone.
say this first.
What?
What?
I know what you're going to say.
What am I going to say?
You're going to talk about the doggy Xanax.
No,
Oh,
I wasn't.
okay.
I wasn't, actually. What I was going to say, any recommendations for stressful car rides? Mr. Bosley Beefcake gets nervous in the car. Yes, we will talk about that. But what I was going to say is some of these medications are also human medications. So if you have them at home, do not give them.
Don't just give them.
Don't give them because
The
we
doses
do it.
are very different.
Yeah, we do it in a very specific dose. There is a range. It is calculated based off of weight. So in people, it's like, take 2 ibuprofen regardless of how big you are.
Which blows my mind.
It's crazy.
How is a little tiny 100-pound person and a 300-pound person taking the same dose of ibuprofen? I don't get it.
I don't get it
In
either.
my world, that doesn't make any sense.
But for dogs, we calculate everything specific to their weight. So if your neighbor has, a 75-pound dog and the vet is giving him, 100 milligrams of something, do not give your 25-pound dog 100 milligrams of the same thing that this dog is getting. Just don't do it.
Exactly.
I didn't want you to start rattling off, like, gabapentin and Xanax and stuff, and people are like, oh, I have that at home, and they start giving it. I didn't want that to happen.
Well, that's fair.
So we're not saying to do this.
Yeah, don't do this. These are just things that you may hear about. And it's something you could talk with your veterinarian about of what might be appropriate. And there's different medications that are appropriate to different situations. Oh, it's very bouncy.
It is, sorry.
It's okay. So I thought you were going to bring up the doggy Xanax.
She does hate, so Xanax is just Xanax. We don't have like a doggy version
There's
of
no
Xanax.
such thing as doggy Xanax.
Or doggy Prozac.
Or doggy
People say that as
Prozac.
well.
Or kitty
It's
Prozac.
just Prozac.
It's just Prozac. Or it's just that's exactly what it is. Stop saying that.
She hates it.
I don't know
doggy
why.
Xanax?
I
And
don't
she's
know
like,
why it drives me crazy, but it drives me crazy.
It's just Xanax. Every
it's
time.
like a weird, it's just a weird thing that I have. It's fine.
My dog
I'm
takes
just in-
doggy Prozac.
My dog is also on doggy Prozac. That's funny.
He's
My
just-
dog is just on Prozac.
He's just as crazy as his mom.
I didn't get the special dog variety. Is that safe? Oh my gosh. So short-term sort of medications that we would be looking at for like as needed use are going to be things like Xanax, trazodone, gabapentin, and sometimes we do those things in combination depending on what our goal is. So like dogs that come in that are super nervous for nail trims, and by sort of super nervous I mean they're
Eating
awful.
us.
They're awful for their nails.
Amy almost got her face bit yesterday.
Yes, she did. That's always frightening.
Yeah.
So we'll do a combination of things, and sometimes we do injections, and sometimes we do pills. It just depends on what the situation is, how much sedation do we need, and how happy is the animal to take pills, those sorts of things. And sometimes too, we'll find that one medication, just like in people, one medication works better than another for an individual. So even though it's like, oh, for this I usually prescribe trazodone, but maybe that dog didn't touch them at all, and so we're going to do something else next time.
Yeah.
So sometimes it takes some trial and error to figure it out.
Like going back to the different side effects. Some people can take Benadryl and it makes them sleep for 2 days. Some people take Benadryl and it makes them crazy. It like wires them all up.
Yeah.
So it's the same thing in dogs. Sometimes one medication has the complete opposite effect of what we're trying to achieve.
Yeah. Yeah. And then for those that need more kind of long-term, everyday sort of medications, so that's when we're going to go to things that are like Prozac or Clomicalm or amitriptyline, something along those lines.
Composure.
Composure.
I love the Composure.
I do like starting with the Composure Chews because it's something that is a supplement versus a drug. So it's just something to take the edge off. So that might help with some of the car rides and things. So that would be something to try. And then if that's not sufficient, we could move on to something else. So just let us know.
There's also Adaptil.
Yes.
They've got the
pheromones.
sprays and the plug-ins and wipes and all of that.
Thunder shirts also are helpful. So if you haven't seen those before, it's just like this jersey, cotton jersey material that it hugs them real tight and it releases some endorphins. So that's great too because it's another non-drug thing that we can do, either alone or in combination with medications or supplements. Yeah.
We're not against medication.
No.
But it's nice to try things that...
And I think, because it's part of my issue with medications and just jumping to that is I think that too many people expect it to be a magic fix. And they're not putting in the other work that it takes to correct the behavior, or they just get more frustrated when it's not working because they expected it was just going to magically fix the whole problem, and it's like, no, that's not going, we're not going to drug up your puppy so it can sleep at night because that's not a behavioral issue per se. It's just he needs to be worn out and he's a puppy. So I'm very hesitant to aggression. And some of these drugs can cause bite disinhibition. Do you know what that means?
No.
So, most animals will give you some kind of warning and some kind of ramp up before they bite. And they're trying to control themselves. They're trying to give you the warnings first. Most of them don't just bite. There's usually some other kind of signs before that.
Growling.
Yeah, exactly. Or they're showing you some kind of anxious behavior like the wide eyes. We call it whale eyes. They might just freeze. These are all things that they can show that tell us that they're
do these things
unhappy.
while you're describing
Could you? That would be great. Would you whale eye for us? Is that your version of curling your
yes.
lips?
That's
Would
it.
you give us a growl as well? You kind of look like a chihuahua right now. That's just a normal chihuahua. So these are all things, and this is why the trainers will tell you don't want to punish the growl, because that was their warning. And so if you're eliminating the warning, they're going to go straight to biting. So that's not good. So
it's hard. It's hard to not punish the growl.
It is, and I think you need to figure out what's happening in that situation that's causing it. Is it a small child is in the area and they don't like small children, well, remove the pet or the child from that area. Don't just punish the dog for growling at the kid. Why are you smiling?
Just the way you said it, remove the child or the dog. Get
them out. Get them out of the room.
I know what you're saying, but you're like, I know how you feel about children, so it's funny.
There's that too. Get rid of the kid. So you don't want to necessarily punish the growl because then you're eliminating that warning system, and then they just go straight to biting. So same thing with some of these drugs is that they may cause bite disinhibition, meaning that they're more likely to go straight for the bite rather than these other signs of stress and anxiety. So we don't want that. So they could get bitier. That's bad. Bitier. That's a word. So we don't want that, obviously. So that's why it's important to not only work with a trainer, but also talk with your veterinarian about what medications are appropriate for different situations. And that's another reason why we may not want to start medication straight off the bat. We may want to try some other things first, because being on the medications could make the problem worse, which would be bad.
That would be bad. Mm-hmm.
For those that don't know, that would be bad.
She's so smart, you guys.
I'm smart. So that's why we have to be careful. That's why we don't just, here's your drugs.
Have fun.
Best of luck. Best of luck to you.
We were both going to do the same thing.
I
thought about it, but my hand was under my leg.
We have the same mannerisms now.
Yep.
So I think, when we're dealing with any kind of behavior issue, the big takeaway is to work not only with your veterinarian, but also a good trainer. And not all trainers are created equally.
I noticed you said a good trainer.
A good trainer. That. These are not problems that I would trust the trainer at PetSmart with. And that's not knocking them. I don't know them, but that's not their area.
Well, and some things may not be solved by just a trainer.
Mm-hmm.
We'll talk a little bit, just a smidgen. I have one at home who's food aggressive,
mm-hmm.
and so when it was very difficult for me because it wasn't always around food, and
mm-hmm.
it was just random things. He would become not himself, I
mm-hmm.
guess is the best way to put it. And so just a trainer would not have been beneficial to him for
mm-hmm.
that.
Right.
And they do have animal behaviorists as
yes.
well that you can see.
True.
They're not cheap, and so I didn't take him to one, and knock on wood, he's been doing really well with
mm-hmm.
medication.
Mm-hmm.
And he's actually on the Composure, and he
mm-hmm.
takes the doggy Prozac.
He takes that doggy Prozac.
So he gets...
But you also manage the behavior.
I do.
You can manage it to some degree.
I do. And we're very careful. There's no food around,
mm-hmm.
With him out. If we're eating dinner, he gets put away. And there's different things that you can do at home depending on the situation
mm-hmm.
To try to help them as well. So
mm-hmm.
if just medication or just seeing a trainer is not enough, there are other options
mm-hmm.
that you can take advantage of as well.
And especially if I'm seeing things like aggressive behavior, there was one that was being aggressive toward one owner, but not the other. I'm like, that I feel like is something we need a consultation with the behaviorist about.
Mm-hmm.
And especially since we were talking about aggression, and like I said before, worried about certain drugs making aggression worse. I was like, honestly, that is beyond my comfort level of trying to medicate that or work with that. You need to go talk to a behaviorist.
Right.
So there are board certified animal behaviorists that are veterinarians, so they can prescribe medication if needed. Unfortunately, I think the closest one is in Illinois. The good news is, at least right now, and I don't know if she'll continue it forever or not, her name is Dr. Koch. She is doing virtual visits And so, yeah, you don't have to live nearby, because I think she's somewhere outside of Chicago now, or it's something. It's not like, oh, it's just across the river, Illinois. It's like,
I thought there was one at Mizzou.
That's Dr. Koch. She's not there anymore.
Oh, okay,
yeah,
she moved.
she's
Okay.
not there anymore.
Because I did look into it for Jace.
Mm-hmm. She was at the Mizzou Cancer Center,
Okay.
and they have not gotten one back there. So, yeah, unfortunately, we don't have anybody that's super close by. But the good news is they're doing virtual visits, and I think pretty much all of the veterinary behaviorists are doing virtual visits now. So even if you just didn't want to see her virtually, you can pick somebody else. It doesn't matter. It's all virtual. You can find somebody in California if you want. Whatever. But seek help.
Seek life elsewhere. But yeah, so those are options as well, to see someone who does this specifically, and who has lots of knowledge about the behavior and why that may be happening and that kind of stuff too. So
yeah, and then again, not just medications, but ways to manage things to do training wise. They may have other ideas of things that can be done. So,
and I want to get a little bit sad for a second.
Okay, you can get sad.
If you have tried all that you can try, don't feel like you failed your pet if you can't get something under control, because that's something that I will say I felt really guilty, and I was considering euthanasia with mine that was aggressive at home, and I came into work one day and I was crying, and I'm like, I don't know what to do. I can't live like this. It's not safe for anyone in my house. He was never aggressive towards us, but it was the other animals, and I have 2 small kids in the house, and I'm like, I can't allow that kind of behavior in my house. And he's my favorite dog. It's not like I was just, he, attacked one of the other dogs one time and he's gone. I tried lots of different things, and finally we figured out a regimen that worked for him, but if it hadn't, he would have had to go to heaven. And it breaks my heart and it makes me really sad, but you said something to me that really, really helped. And do you want to share with them what that was?
What did I say? Oh, yeah, that's what I was going to say, too. Yeah, because if it's, when we're talking about euthanasia for behavioral issues that we have, and I'm not talking about, like Crystal said, it's not just like, he's kind of growly, so let's put him down. No, and then this is very different than what we would call convenience euthanasia. These are not healthy animals. They are not behaviorally healthy. And just like any other health condition, if we cannot fix it, if it cannot be treated or it cannot be managed, euthanasia is a reasonable option. And like, obviously we're not advocating to just like, one behavior issue and we're done. Obviously you try things first if it is safe to do so, but these are not healthy animals, and so it stinks. I have been there, but it's not an unreasonable thing to think about or talk about.
Are you crying?
Not yet.
Your eyes look like they're watering a little.
Nobody can see that, though. There's a reflection from the glass,
that's true.
But you just told them anyway.
I did. I was starting to tear up, too. Because I remember what it felt like. And every once in a while, like every night I would go to bed and I would just, right before I would fall asleep, I would have such anxiety. Especially if my husband was still up and I was going to bed, because he usually feeds the dogs at night, and he's not quite as careful as I am. Yeah. Which drives me crazy. But I would have anxiety right before falling asleep every single night. Like, is he going to attack the other dogs?
Because to hear the noise of them like attacking each other.
Let me tell you, when you're sleeping and you hear that, like, you can't unhear it. And when I say that he became not himself, it was like a flip switched.
Oh, yeah. Like, you could see it in his eyes.
Switch,
Like,
flipped.
a
I
switch
always say
flipped.
that backwards.
A flip switch.
I always say it backwards. And you could see in his eyes, like, he was not
didn't look
himself.
normal. Yeah.
No, I mean, it happened at your house
Yeah.
once with one of your dogs.
Yeah. But that was her fault. That wasn't his fault.
Well, but still.
She got what was coming to her. She ran her mouth to him for no reason.
Yeah.
And But
I mean,
like you could see it in his face. Like his eyes were like wide and he was just like panicked there. And I was like, I'm not going to touch him because he is not my dog. I'm like, just go to your crate. Just go to your crate. And then once everything calmed down, then he was fine. But you could see it in his face that like, something was different. Something was changed.
So, I mean, I can tell you, I know how it feels. I know what you're going through.
Mm-hmm.
And I mean, every once in a while, I still have anxiety about, like, is he going to get out? Is something going to happen? Because, like I said, it wasn't just food. And, sometimes it would be while he was outside and there was no food around and something would happen that set him off. But luckily, like I said, we've got him on a good regimen. Nothing has happened recently.
Yeah.
But, if you're worried, come in and talk to us because we may be able to help you out, and we've been there. We know what you're going through, and
no judgment.
It's not an easy decision
Yeah.
to make one way or another, and especially, you have to consider what your house is like. If you have children, if you have other dogs, if you have people in and out of your house a lot, you have to take all of those things into consideration when you're talking about your pet's safety, their safety, and just everyone involved.
Yeah.
It's not fair to just ignore what's happened or what's happening and hope that it goes away or gets better. You have to face it head on and try to get it figured out.
Is our appointment here? Are you coming to summon us?
That was creepy.
Really creepy. Oh, Brittany. She's very creepy.
She's the creepiest.
Yeah,
You want to say hi?
Are you going to come be creepy?
Hi, Facebook Live.
She's such a creeper.
She really is.
Oh, goodness. But yeah, so if you have any behavioral issues, questions, anything like that, definitely, it's always good to rule out any kind of medical cause for whatever you're seeing, whether it's aggression or anxiety. Is there any kind of like pain involved or, something that maybe you're not seeing? So get them checked out by your veterinarian. And then you can talk about next steps of whether it's training or medications or referral to a behaviorist or whatever.
Talk about the car rides real quick with the roamers.
Well, I was saying they should probably try the Composure Chews.
Composure chews?
Yeah.
Not the Dramamine.
Well, I would do that. Well, it depends. Depends on if he's
Okay.
getting car sick or not. It didn't sound like it was a car sickness. Pull the comment up again.
Any recommendations for stressful car rides? He gets nervous in the car.
Yeah. So if he's not getting, if he's getting like super drooly, it might be like a nausea thing, and then maybe some Dramamine, and we can give us a call. We can get you a dose for that. But if it's just like shaking, I gotta demonstrate it in case you don't know what shaking is.
Yeah.
Shaking or like pacing back and forth, like acting real anxious, those sorts of things.
Do a lip curl. That's pretty good.
If those are things that are happening, then something like the Composure Chews would be a great place to start.
I love them.
Or if that doesn't help, then we can talk about some as-needed drugs.
Yeah.
So. Yeah, but I would let us know if it's like a nausea thing. We'll get you a dose for some Dramamine, and if it's not, then come on by and pick up some Composure Chews, and we'll give that a go.
Yeah, we do have those in stock. You can give them every day, or you can give them just as needed.
Yeah, and I think you're supposed to give them like 30 minutes to kick in.
Yeah.
But just a little tasty treat. Like I said, it's not gonna like knock them out or anything.
Hide them because they
They
do like them.
They might want to eat a whole bag if they have access. So Yep.
All right.
That answer that? Is that
Yeah.
good? Do you
That's
approve?
good.
Okay.
Yeah.
All right. Well, we gotta go. Let us know if you have any other questions. Have a wonderful day.